In January of last year, we traded our RV that we had then in on a new one. So 1st of March, we took off across country and we stopped anywhere we wanted to for a while. Everything was so unique to what we were used to seeing that it was really interesting. It all went the way we had wanted it to.
We were staying in a suburb of Phoenix. It was about 2 in the morning, and she was kind of thrashing in the bed. I realized that she was probably having a stroke because of her facial expression, and so I called EMS, and they were there within 10 minutes, and she was in the hospital 15 minutes later.
I was working one morning, and my dad called. I could tell by his voice the minute he started speaking that it wasn't good. I threw a whole bunch of stuff in a bag and just went to the airport, and a few minutes later, our practice president called, and Dr. Mattern said, "I am so sorry. I'm getting ready to call Dr. James Lyons. He's there at the same hospital." And I said, "That's fantastic." And before I could get on the plane, Dr. Lyons had already called and was checking on me, and he was getting my mom's information and looking through her case and just kind of watching her for me. And he was just part of the RP family. And I took off and went to Phoenix.
Kathy had her stroke in the middle of the night on Tuesday, and she recovered so quickly that by Saturday we were having dinner in Old Scottsdale.
I just went from having that 1 week to get right back to where I was.
We got back to Greensboro around the 12th or 13th of July, and then on the 16th of July, I noticed that Kathy was having some short-term memory issues, and they were significant, and it seemed like it happened just all of a sudden, but we went to the ER, and it was confirmed there that she'd had another stroke.
What I do remember is thinking this was too much. It got to the point that I thought me just giving up and going was the better solution.
My dad reached out and said that they were discussing a procedure that needed to be done by interventionalists. I perked up a little and I said, "Now I can help here." Dr. Suttle, who is the newer physician I'd reached out to, when I called him, he said, "Give me a few minutes to look at it." And he replied back to me and he said, "Man, she could really use this. This would definitely help her." He brought Dr. McCullough in and they started working on it and looking at it, and they were able to get it scheduled just a couple of days later.
Thoracic duct embolization is one of the more challenging procedures that we perform in the hospital setting. There are essentially 3 stages to the procedure. The first stage is to successfully perform the lymphangiogram, which typically is done by ultrasound-guided puncture of the lymph nodes themselves, and then slow installation of iodinated poppy seed oil, which goes by the brand name of Lipiodol. So here on the screen, this is a 25 gauge spinal needle. You can see right here, we're coming in longitudinally and puncturing. We try to get the needle tip directly in the center of the lymph node. You can see here, this is the 25 gauge needle, and this is the Lipiodol starting to fill the lymphatic ducts. Another view here, you can actually see the lymph node parenchyma itself opacifying. You can see the ducts coming out, and everything is starting to march north as we expect. Once that Lipiodol gets up to where it coalesces into the thoracic duct, you then have to try to do a percutaneous puncture of the thoracic duct, and it's very small. It's usually on the order of between 3 and 5 millimeters. The third stage is actually following the thoracic duct all the way up into the chest where it empties into the subclavian vein on the left, coil and glue embolizing it to completely shut that down. That stops the antegrade flow of lymph fluid through the chest and blocks off the leak. And what you end up with is a picture like this, where here you can see our coils, and then all of the dark glue that you see here in the thoracic duct, that is all Lipiodol and glue. You can see the glue filling all those little collaterals, and now the thoracic duct is embolized. And so the day of the procedure, as we talked about, she was putting out between 700 and 900 mLs of chylous fluid every day. The day following the procedure, the color and the character of the fluid had already changed to more of a serosanguinous look, and it had decreased to about 250 ml. By post-op day 2, it was down to 50 ml. By post-op day 4, it was down to less than 10, and they successfully removed her chest tube. It still took a few weeks for her to leave the hospital because of everything that she had been through. She had been through just a tremendous amount of procedures over a 2-month period, but ultimately was able to go to rehab and then finally go home. And so we were very, very privileged to be a part of her care that helped to get her to that point.
I don't know that anybody had any idea this procedure was going to be so profound. I know I didn't. It was like a whole different person woke up the next day.
I just want to make sure that we express our gratitude for the care that Kathy received. And we just appreciate the professionalism and the care and the genuine concern for not only for Kathy, but for me as well. And we really appreciate that.
It completely changed my perspective and how I think about what we're doing, because there were days I wasn't sure she was going to be here. I will be eternally grateful for Dr. McCullough and what he did and the success he had with that procedure.